Hello, everyone. This is Dr. in the House. My name is Chris Carter. I'm excited to be here with you today. And of course, if you're just joining us for the first time, this is the show I like to call the consultation before the main consultation when you get to a hospital. So basically, we get to talk about our health, we get to talk about different conditions, we get to know them, we get to know how to treat them, or even how to manage them or avoid them. So today we have Dr. Kelvin Owusu, who's a wellness consultant at Violet Medical Center, and we are going to be looking at diabetes and your eyesight. Diabetes and your eyesight. So we've been talking about diabetes for 2 weeks now, and today it's all about diabetes and your eyesight. And usually we all know it, it affects the blood sugar, but a lot of people do not know it also affects your eyesight. And these are some of the complications that come with diabetes. So if you're watching me today and you have any questions concerning this discussion, I want you to send all those messages via the WhatsApp number on the screen, and the doctor will get to answer it all. Anyway, let's get into the conversation. Hello, Doc. How are you?
Very well. How are you?
I'm fine, thank you. This conversation is a very important conversation for me because it hits close to home, diabetes and your eyesight. And it's called diabetic eye disease. So now, why does it affect the eye? Because we've been talking about it for 2 weeks now. We've talked about how it affects it affects pregnancy or how it comes to pregnancy, how it affects the health and all that. But now it also affects the eye. Can you tell us how it affects the eye?
Well, I'm actually happy that we are doing an extensive discussion on diabetes, because, I mean, what people don't realize is that diabetes is a multi-system, multi-organ disease. It can affect every part of your body from your head to your toes, So the way we are breaking it down is very, very good for everybody to be aware. But I also like to say that sometimes when we do these sessions, it can get a bit depressing and discouraging, because we kind of hammer on the negatives, and, then everybody's wondering, so then what should I do? Let me just allow myself to just die.
Go to the hospital.
Yes, but the idea is that we want to let you understand how serious the conditions can be, and so the reason why you must go to the hospital and get regular checks. So that is why this is important. So yes, diabetes does indeed affect the eye. In fact, when we say diabetic eye disease, it's not just one disease condition. It literally, almost every disease that affects the eye, diabetes speeds it up. So I'm sure you may be aware of glaucoma.
Yeah, glaucoma,
you may
cataract.
Be aware of cataract, yes.
And even permanent blindness.
Yes, I mean, cataract, glaucoma, these are leading causes of blindness by themselves, you understand. Then with the diabetes, also causing other things, including macular edema, retinal detachments. So long and short, diabetes can make you blind, And that is why, eye examination for a diabetic is something that we shouldn't compromise on. And that's actually one of the key things I want to leave you here with today, because many of our diabetics are not getting their eyes checked.
Maybe they check everything but except their eyes.
Yes, they are not checking their eyes. Maybe because of lack of awareness or non-availability of resources, or whatever the reason is. A lot of our diabetics are not getting eye examinations. As a diabetic, you need to get your eyes checked. First of all, as a human being, you need to have your eyes checked regularly, at least once a year. You need to have an eye examination just to make sure that your eyes are good. Some of the people watching us, some of the people in this room, the only time they have their eyes checked is when they go for their DVLA, renewal, their license renewal. But that one too is just a quick check. Most of the time they don't go into detail. So most of us have eye problems that we are not aware of.
Right.
Diabetes as a disease affects the eyes. And the eye, we've said it in literature and other areas that is the window to the soul. Because when you examine the eye, you get to actually see the state of the entire body. So when you see changes in the eye, as a diabetic, as a doctor, if you see changes in the eye of a diabetic, it tells you that these same changes are also going on in other parts of the body. So it helps you to monitor the person's treatment better. So if we are not checking the eyes of our patients, we are doing them a disservice. So it's important that you get your eyes evaluated as a diabetic very often.
All right, so how does this actually, affect your eye blood vessels?
Okay, so first of all, we need to understand that the blood sugar, I think the last week when we were here, we spoke about it. When the blood sugar remains high for a long time, it begins to cause complications for the blood vessels. in the eye and other places as well. You know, some of the changes include atherosclerosis, which we mentioned in the previous episode. You know, and that can limit how much blood is even going into some of these places. You know, so when this is happening in the eye, either as a result of the blood sugar itself being high, because remember that the eye, inside the eyeball, there are fluids in there as well. Yeah, so inside the eyeball, there are fluids in the eyeball itself, and these fluids also have a certain amount of sugar in there. So now, if the blood sugar is high, then it means that the sugar going into the blood, the fluids in the eyeball will also be high, and that can start a process of of damage. This sugar can enter into the lens and change the crystal, the crystals in the lens. So the lens in the eyeball is what focuses the light.
Right.
You know, you see because there's light. You know, so now if there's a problem with the lens, you are going to have challenges seeing, and the blood sugar being high can begin to opacify the lens, and that is what we now call cataract. So diabetes can speed the progression of cataract. Or first of all, the development of cataract and the progression of cataract. Diabetes can do that. So diabetic or people with cataract, a significant majority of them have diabetes. Whether the diabetes has been diagnosed or not, that's a separate conversation. So for some people, the first time they are diagnosed as being diabetic is when they go in and they realize that they have cataract.
Oh my!
You understand? So that's the lens. So the pupil is the hole where the light will enter the eye. The light goes to the lens, and then it passes through what you are seeing over there as this red background. It's actually fluid in there, and then goes into the retina. The retina is at the back of the eye. You understand? Now you can see these blood vessels. So these are the blood vessels that we are talking about. So when you do an eye examination, the doctor is able to see the blood vessel, the state of the blood vessels. Now, people who are diabetic, they can go through certain changes in the blood vessel, which results in what we call microaneurysm. So like the blood vessels begin to balloon because of weakening of the wall of the blood vessel, because of what I've spoken about, the high sugar, atherosclerosis, and other things. So the blood vessel begins to balloon. And then because that portion where it's ballooning is weak, it can also break. So then they can have episodes of bleeding into the vitreous. The fluid in the eyeball is called vitreous humor. They can be bleeding into that vitreous humor, which will affect the vision. You understand? So there's a lot that can go wrong. Now, when the body attempts to heal these blood vessels that have been damaged, you know, it forms scar tissue. You know, kind of like when you have a cut on your hand, it forms scar. Similar scar can happen in the eye. Now, again, when you have a scar on your skin, you notice that the skin is pulled a little bit. Because the eye is so delicate, when that area begins to pull, then you begin to develop things like retinal detachment, because that pulling of the skin to form the scar affects the retina.
Start detaching the retina from the eye.
Exactly. So that is kind of like the ultimate, because when your retina detaches, you most likely not be able to see. And for a diabetic whose blood sugar is poorly controlled, even if that retinal detachment is detected early and repaired, the outcome is not usually good. So we don't want you to get to that point at all.
Is it what's called retinopathy? No.
So retinopathy is, how do I put it? What I described earlier, where there's these microaneurysms and the bleeding, you know, happening intermittently, is all part of what we call the retinopathy. Because remember that the blood vessels are in the retina. You understand? So as the damage is going on, all that forms part of retinopathy. Retinopathy is just a big word.
Detachment of the retina.
So retinopathy can result in the detachment. But we don't want to get to the detachment, because the detachment is kind of like the final, in a
final stage of the whole thing.
So we don't want to get there, you understand? We want to prevent it as much as possible. And all this is happening because the blood sugar has been left uncontrolled. You understand? So if you are a diabetic, and first of all, if we diagnose the diabetes early, because I already mentioned that for a lot of people, the first time we even realize that they are diabetic is when there's already a complication. We don't want the complication to occur at all. And a lot of people too, it's typical of Ghanaians, we wait for symptoms. Unfortunately, even though diabetes as a disease can give you symptoms, including frequent urination, weight loss, or weight gain in some people.
Or ants going around your pee.
Exactly, ants going around your pee. These are some of the symptoms or signs of diabetes, right? When it comes to the diabetic eye disease, for most people, there are no symptoms. So the first time, you have a problem with your eye,
it's when you might just discover.
Exactly. Then you're already going blind. You see, so it creates a big problem. So I mean, I think there's this image that is being shown here where you are seeing some of the different changes that can go on in the diabetic eye. So the cataract, as you can see, the lens is opaque. So the light cannot even go through the lens in the first place. Okay. Yeah. So yes. So over here you can see that the lens is opaque. So the light is not even going through at all.
Yeah.
So this person cannot see.
Right. Okay. Yeah. Okay. So there's this block.
Yes. So there's this opaque thing in front of just behind the pupil. The pupil is where the light is supposed to pass.
And I hope people understand what opaque is. Transparent, translucent.
Exactly. So transparent is what you can see through.
Yeah.
And
translucent is a bit, but opaque is
you can't see at
like
all.
A wall.
Exactly. So the cataract starts and it progresses, and as it progresses, the lens becomes more and more opaque. You see, and so the light's not even going through at all for you to see. Then we have the glaucoma. I didn't mention glaucoma yet.
Pressure.
But yes, the pressure inside the eyeball is increasing, so whereas you have hypertension where your blood pressure is increasing, glaucoma is
blood pressure in the eye.
Yes, pressure in the eye is increasing. So when you go to the hospital, they'll probably put some device on the eye to measure the pressure, and the pressure is beyond a certain point, then we say you have glaucoma. Diabetes causes an increased risk of glaucoma, you understand, and glaucoma can also cause blindness because it puts pressure on the optic nerve. The optic nerve is at the back of the eye. Okay.
And I can see something that damaged canal blocks. That's too much fluid down there.
Exactly. So when the pressure increases, it destroys the optic nerve. Now, if the nerve is destroyed, then you can't see at all. So that is how glaucoma also affects the eye. Okay. Then you mentioned the diabetic retinopathy. So you can see the bleeding, the ballooning of the blood vessels, the bleeding, exactly. And all this, yes.
Abnormal growth of the blood vessel.
So the abnormal growth of the blood vessel is because the body needs blood carries oxygen. So when you have these aneurysms and these bleeding points, it means that the portions beyond where the blockage has occurred, the blood is not reaching. So the body wants more blood over there, so it begins to develop new blood vessels. These new blood vessels are weak, so they are also more likely to bleed. So it's a whole complicated melee that we want to avoid. And all this is happening because the blood sugar was poorly controlled.
You know why I like this show? I like this show because it actually opens your knowledge to a lot of things. I never thought that, okay, the diabetic eye can cause glaucoma, cataracts, and all that. Maybe I'll just stick to the diabetic retinopathy, but not glaucoma.
Individually, each of these conditions will cause blindness.
Yeah.
Now, as a diabetic, you are at risk of all of them at the same time. So that is why we need to get regular eye checks as a diabetic. You understand? It's not something that we can ignore at all, And oftentimes the challenge is always money, It's sometimes being a medic is very difficult because we know what we need to do, but unfortunately because our health system is a bit, let's just say it's a bit disjointed, right? So most hospitals do not have all the specialties available. The patient has to move from this hospital to go for eye check in another hospital and pay more money, registration fee, consultation fee. It creates a barrier. So that is part of the reason why we have so many of our diabetics not getting proper holistic care. You understand? Because but as an individual, you need to understand that you owe yourself that duty to go and get your eyes checked, even if your doctor does not recommend it. It's important.
Right. Because I remember a friend of mine actually, not here, in the States, and we're talking and they said, oh, I'm going to check my eye. I'm like, oh, what's wrong with your eye? It was like, oh, there's water leaking from the, I'm like, leaking out? He's like, no leaking inside. In the eye.
Yes.
I'm like, wow.
That's another complication of diabetes as well.
And of course, and his diabetes too.
Yes,
so
that's another complication.
So how do you do that? What's going to happen? Are you okay? He was like, no, he just needs to check it. And then his doctor will tell him. So he checked everything. And thankfully, they just sorted it out. So like you said, some of these things, we need to keep going to the hospital. But because our system it's a bit,
Yeah.
hard. People find it hard to keep
Yeah.
going to the hospital.
It's true. I mean, even as a medic, sometimes it's frustrating. I mean, not sometimes.
You worry.
Yes, because you see a patient and you know that this patient, we can help this patient, but where are the resources to actually help this patient? So it can be distressing, depressing, and whichever adjective you want to use.
Yeah. So apart from sugar levels, what other lifestyle factors affects the eye when someone has diabetes?
Well, I mean, there's also the component or the aspect of, before lifestyle, there's the aspect of family history, you see, because again, all these conditions can occur outside of diabetes. So it doesn't mean that only diabetics will suffer these conditions. If your family has a history of cataract or glaucoma or some form of retinopathy, it's not only diabetes that causes retinopathy. Hypertension can also cause some retinopathy as well. So you need to know your family history so that you can put certain things in place. But when it comes to the lifestyle, it's the same things.
The same thing. Exercise, eat
proper,
well,
exactly.
do not smoke, do not overdrink.
Because smoking, for instance, independently will cause atherosclerosis, which diabetes can also cause. So obviously, if your blood vessels are being damaged, then you stand the risk of some of these complications as well. So the general health rules apply. A diet that is rich in fresh fruits and vegetables can help. Yes. Now, this is showing us how people with the different health conditions, in terms of the eye, actually see. See things. So over there, you see in the normal vision, you are seeing the picture clearer. Then when you start developing cataract, or as the cataract progresses, you have the whole vision. So because the lens is where all the light passes,
the opaqueness,
your vision is going to be blurred. And it can even become worse as the cataract progresses, you see. Then you have the glaucoma, where because of the damage is coming from the optic nerve, it starts from the outside. So you notice that the outside of the image is a bit, not too clear, and it progresses inwards. And
then it just closes up.
Exactly. Then we have
diabetic retinopathy.
Because the bleeding is happening at different points in the eye.
So there's spotting.
Yes.
In your vision.
Exactly. So your vision becomes a bit checkered. So that is how that looks like. Of course, there's total blindness where you're not seeing anything at all. So yes, diabetes can cause a lot of these.
Seeing this just scares me. Like seeing all this right now, I'm like, nah.
So the thing is, some people may have had this problem for a long time, and so they begin to think that is how normal vision is.
Ooh,
you see that because they've lived
and they've
with
never
it
checked.
Exactly. So that is why you need to go for regular eye checks.
Let me see where I am. I think I'm in my normal vision right now. I think I'm in my normal vision right now. May I remain in the normal vision for a long time? But anyway, you talked about blood pressure. So how important is your blood pressure and your cholesterol levels when it comes to protecting your eyesight?
Again, hypertension as a disease also affects the eye. You understand? Then there's a close relationship between hypertension and diabetes. As for cholesterol kind of connects everything. You see, because cholesterol itself, as your cholesterol levels build up, it increases the amount of deposits in your blood vessel, so that the way the blood is supposed to move is not able to move as such. And because of that restriction, your blood pressure goes up. So there is a connection between cholesterol and hypertension.
That's exactly what I was going to ask you, because when someone has hypertension, you get to check
the cholesterol,
the diabetes. You get to check diabetes.
So
you get to check the kidney. You get to check all that. But now, I wanted to ask you. So when your cholesterol is usually high, they need to check other things too.
Of course. They move together. So there's a correlation between hypertension and diabetes. So that is why people who are diabetic, they have a lower cutoff for being diagnosed as hypertensive. You understand? Because the diabetes itself is damaging the blood vessels. So if you allow the blood pressure, if you use the same criteria as you would a normal person in quotes, by the time they get to that point, the damage would have already occurred. So what I'm trying to say is that typically we will start hypertension treatment at 140/90. But if the person is diabetic, we may start the medication at a lower cutoff, maybe 135/85 or something. And the reason is because diabetes is already damaging the blood vessels. So if you wait for this person's BP to go to 140, it might cause further damage. So you want to prevent it. You understand? We do know that people who are diabetic, about 60% of them will develop hypertension along the line. And the reverse is also true. People who are hypertensive, a significant majority will develop diabetes along the line.
Wow.
So once you have diabetes, we need to start looking out for hypertension and vice versa. And if you have both hypertension and diabetes, then we need to even be doing these eye checks at a much more regular interval. So if we're doing it once a year, we probably have to start doing
6 months?
Yes, because both of these disease conditions affect the eyes individually. So now, in combination, we really need to pay attention to the eyes.
All right, so Doc, now we know that you have diabetes, like the diabetic eye. What sort of treatments are there?
So it depends on which particular one that we are dealing with. If it's glaucoma, we need to incorporate some some medication to reduce the eye pressure. You know, if it's cataract, you will need some form of surgery to replace the lens, remove the lens, and then replace it with an artificial lens to do to continue the function of the lens. You know, if it's the challenging ones, then become the diabetic retinopathy. You know, where you may require some laser treatment to correct some of these things. You know, and I mentioned that retinal detachments can be repaired, especially if you report early. Unfortunately, most of our people don't report early, so it tends to be permanently damaged. But even if you do report early, provided the blood sugar is not out of control, then you can get some good outcome. But if your blood pressure is out of control, we might still struggle. But you see, the reality is that the person whose blood sugar is out of control is probably out of control because he doesn't come to hospital anyway. So most likely that person will not come to hospital with their retinal detachment early. So it kind of, you know, continues the trend along that line.
So now, we've talked about it in adults. Now, let's look at younger diabetics, right? Younger diabetics, do they also face the same problem?
Well, thankfully, younger diabetics do not necessarily face similar problem. However, in this era that we are seeing an increasing number of type 2 diabetes in the younger, exactly, you know, we are most likely to start seeing some of these complications at a much younger age, you know.
But Doc, I have a question. Like, has it always been like this, where we see young diabetics, you know, especially with the type 2 diabetes?
So if you limit your questions to type 2 diabetes, then no.
It hasn't
always been the case that we have so many young people developing type 2. Type 1 is more common in the younger population because that is autoimmune, you understand. But type 2 is a new age trend. And it's because of the increasing incidence of increasing prevalence of childhood obesity. So we are getting more children being overweight and obese. And it's a part of our social construct because
where everybody's
more and
busy.
more schools are no longer developing sporting activities.
True.
So the children are not playing outdoor as much as our time. You know, I mean, our time we had a full-length football pitch, you know, to play on. Now most schools are doing like a quarter, you know, some.
True.
So the children are not playing outside as much as we were playing in our times. Again, our time, there were not as many cars, so that we could go outside and play in the streets, you know, go and visit your neighbors. Now, your children are stuck in the house the whole day, playing video games. So and they are eating a lot more junk food now than. So
would you say the parents sometimes also contribute?
So that's what I mean by the social the whole social construct. It's part of the thing, and that is why we are seeing a lot more children with obesity today than back in the day. And because of that obesity, we are seeing a lot more type 2 diabetics now. You know, and the thing about the child with obesity is that even if the child does not develop diabetes now, the risk of developing type 2 in a younger adult is still very high. So we have to find a solution to the child with obesity problem to avoid developing some of these things too early in life.
I hope as we are on live right now, schools are watching us, teachers are watching us, parents are watching us. It's become an issue of concern. And if you're concerned about your kids' health, maybe it's time for us to have conversations with the schools during PTA. Let's think about it. But now, Doc, we've talked about the kids. Let's talk about pregnant women. You know, last week you told us that, you know, a pregnant woman can actually develop diabetes in pregnancy. And does the eye issue also affect them? I
mean, it depends on how serious the diabetes is in pregnancy, because the key word here is that if the sugar level is poorly controlled, then your risk of all these complications will increase. So if you are pregnant and you do develop the diabetes during pregnancy, if it's not recognized early, for instance, or it's not managed holistically or managed appropriately, you could develop these complications, even though we don't see it as often, because thankfully the pregnancy period is limited, and most people who develop diabetes in pregnancy, when they deliver, the diabetes goes away,
right.
But there's still that possibility of complications with your eyes if the sugar level go that high and stay high for a prolonged period of time.
Right. And now this is a very important one, because you talked about screens. We're all on the screen. Everybody's using the mobile phone right now. Social media is taking all our time. People are watching me right now on TV and even their tablets. Now, should a diabetic be worried about using his screen or her screen or working long hours? Because these days, everybody's on the laptop working.
Yeah, I mean, you have to work to eat, so I mean, it's a difficult area. But I mean, the thing is, you need to use appropriate screen settings. First of all, you need to use appropriate posture. We actually need to have a session on how the impact of screen on your posture, because now we are developing a lot of bone problem because of the posture that we assume when we are on the phone, on the tablet, or even on the computer. So the posture must be correct. In other words, you need to have your display at appropriate height, appropriate eye level,
like that.
And then the settings, not too bright, not too dim,
dark,
so you don't want to strain the eye, because when you strain the eye, it can also affect the lens, and then you probably would need glasses, because you have now developed either short-sightedness or long-sightedness.
Myopia.
So in terms of diabetes per se, there's really no connection between screen and diabetes that I am aware of.
Right.
I mean, I may be wrong, but as I'm sitting here right now, I'm not aware of a direct connection between the screen time and diabetes. But there are definitely other complications that you can develop as a result of how often we are on our screens. And depending on which type of screen, like I mentioned, because the phone can cause a different set of problems, the computer can cause a different kinds of problems. So we need to be aware of all of these things.
All right. So what message do you have for any diabetic right now who have assumed eye problems are inevitable?
So I'll say that the eye problems are not necessarily inevitable. They are something that we can prevent with regular checkups. And so that's why we say that if the eye of a diabetic will whisper first before it screams. In other words, it will show you subtle changes early.
Like I'm blurry.
Exactly. So that if we pick up those subtle changes, then we know that we need to optimize the diabetes medication or the diabetes control. So if you're able to optimize the control, most of these changes or most of these damages will reverse themselves. You understand? But if we ignore it or we are not even aware of it, then it begins to scream, and that's when you say you are literally going blind. So don't wait for your eye to scream. Listen to the whispers and let's deal with them at that point, so that all the damage can be reversed.
Listen to the whispers, Doc. What's your tip of the day?
So that's what I mean. When it comes to diabetes, the eye whispers before they scream.
Oof, that's a powerful one. This is when the church says amen. Anyway, Doc, how can people reach out to you?
Yeah, so we are quite active on social media, Kelvin Owusu MD on all channels, and also the clinic is also active at Violet Medical Center on all social media channels as well.
All right, thank you so much, Doc. It was really nice having this discussion with you. Ladies and gentlemen, that was Doctor in the House, and the doctor in the house was Dr. Kelvin Owusu, wellness consultant at Violet Medical Center. And my name is Chris Carter. See you next week, the same time, right here.